Health Minister Amprin Lingdo on April 26 reviewed the HR status of various personnel in the health department to find the gaps in manpower and how they can be made more effective, including upliftment of infrastructure. Speaking to media persons after a health review meeting, Lingdo said that there are certain areas in the department with shortages of specialist doctors, and the department has taken up certain important decisions to ensure that short-term courses are conducted for doctors to make them equipped and have sufficient exposure to training so that they can gradually fill all these gaps that are there in the placement of doctors in the institutions. Lingdo also revealed that the state has surplus of nurses as against the number of jobs or vacancies, and the government is looking for avenues through engagements to utilize their services.
So we are now of this opinion that we need to now look for avenues for these nurses. Where do you direct these trained individuals? What do they do next with their lives? So government is going to be engaging with institutions, engaging with various agencies that can help us bring gainful employment to these nurses, because there are more nurses in the market than what government intake can do.
The health minister also pointed to opportunities for these nurses in European countries where there are huge healthcare professionals.
For example, we are aware that several foreign countries require nursing care which is not available in their own countries. Whereas if our nurses, who are already very hospitable in nature, very kind in nature, if they can have a language skill opportunity to pick up a language in any European country, maybe if they could learn French, if they could learn Japanese. I'm told very recently that there was this big requirement for nursing care, nursing aids in these foreign countries. So we now need to look at this huge unemployment even in this one category alone.
She revealed that as per the national norms, the state does not have enough sanctioned posts to absorb the surplus manpower in the nursing sector.
Yes, there is, as per the national norm, we do not have as many sanctioned posts in the state of Meghalaya. So 3,000 plus, I don't remember the exact numbers, we have about 1,500 plus. So we are going to be likely looking at a probable moving to ensure that the sanctioned numbers of such posts, at least as per national norms are already made available. Because every time you have to inaugurate a CHC or PHC that has already been built, then you suddenly come against this hard wall which says there is no sanctioned post.
The health minister also said that there has been a huge focus on funding and improvement of healthcare services in the next 5 years post-COVID, and now the government has to ensure that once these infrastructures start seeing the light of day, they have the necessary manpower that is required. Lingdo also stated that the government is looking at incentivizing health facilitators like doctors, nurses, lab technicians, and other categories of workers so that they can take up work and assignments in remote areas that lack health facilities. For more news updates, subscribe, like and share.